Question 1. A 48-year-old woman presents with dry eyes and dry mouth for several months. She frequently uses artificial tears and sips water throughout the day. On exam, she has bilateral parotid gland enlargement and dental caries. A Schirmer test shows reduced tear production. ANA is positive. Which of the following autoantibodies is most specific for the suspected diagnosis? A. Anti Ro SSA. B. Anti-dsDNA. C. Rheumatoid factor. D. Anti-centromere. E. Anti-topoisomerase 1. Seventh answer, A. Anti Ro SSA. Anti Ro SSA and Anti La SSB are specific for Sjögren syndrome, especially when there is sicca, dryness, and glandular involvement. They are helpful diagnostically, especially when ANA is positive but nonspecific. Why not the others? B. Anti-dsDNA, specific for systemic lupus erythemosus SLE, especially lupus nephritis. C. Rheumatoid factor, may be positive in Sjögren syndrome, but it is not specific, also seen in RA and other autoimmune diseases. D. Anti-centromere, seen in limited cutaneous systemic sclerosis, CREST syndrome. E. Anti-topoisomerase 1, seen in diffuse systemic sclerosis, not Sjögren. Question 2. A 55-year-old woman presents with a long history of dry eyes and dry mouth. She reports difficulty swallowing dry foods and recurrent dental infections. Biopsy of the minor salivary glands reveals lymphocytic infiltration of the glands. Laboratory testing shows positive ANA, positive rheumatoid factor, and elevated Anti Ro SSA and Anti La SSB antibodies. Which of the following is a potential complication of this condition? A. Malt lymphoma. B. Membranous nephropathy. C. Pericarditis. D. Interstitial lung disease with honeycombing. E. Subacute cutaneous lupus. Correct answer, A. Malt lymphoma. Patients with Sjögren syndrome have an increased risk of developing malt lymphoma, especially in the salivary glands, due to chronic lymphocytic infiltration and stimulation. Why not the others? B. Membranous nephropathy, seen in SLE or secondary to infections or drugs, not typical for Sjögren. C. Pericarditis, common in SLE, less so in Sjögren. D. Interstitial lung disease with honeycombing, more typical in systemic sclerosis or idiopathic pulmonary fibrosis, not a classic Sjögren complication. E. Subacute cutaneous lupus, associated with Anti-Ro SSA, but more commonly in lupus, especially in photosensitive patients, not as a Sjögren complication. Would you like